শুরু করো। Hello, Doctor. Hello, I'm Dr. X, a doctor working here today. May I confirm your name and age, please?
Hello, doctor. My name is Harry Bordawe and I am 32 years.
Okay, how may I address you?
Please call me Harry.
Okay, Mr. Harry, today we are going to discuss about your health issues. Will that be all right?
Okay, doctor.
During our discussion, I might take down some notes, which will be strictly confidential. Is it okay?
No problem, doctor.
Okay. Now, Mr. Harry, can you please tell me, in your own words, what have brought you here today?
Actually, doctor, this started a few weeks ago. I noticed that I cannot swallow or I cannot uh, drink properly. I feel some pain during my swallowing food, and for that, I thought it was due to some cold. So I took some hot drinking water, but that problem didn't go away. Rather, it was increasing day by day. And after that, I visited my GP, and first he thought that it was due to my improper inhaler technique. So he suggested me to take some fluconazole and wash my mouth after taking the inhalers. Though I usually wash my mouth after taking inhalers, but I did it more after his advice. The symptoms improved a little bit, but again, after a few days, I felt the same symptom. And at this time, I went to visit him. He thought that this might be some problem with my food pipe, so he advised me some tablet called domperidone that didn't help me a little. My symptoms it's increasing day by day, and now it is somewhat severe that even if I take a less amount of food, I feel the pain. So he sent me here. Why I am having this?
Okay. We will try our level best to find out the cause. Okay. You told me that it started. There is some pain in your swallowing. Okay. Do you feel the pain when? Can you tell me when do you feel the pain while eating food? At the beginning or at the end? Can you
No,
please
doctor, I
specify?
don't feel pain when I chew something, but when I try to pass it down, I feel the pain.
You feel the pain. Okay. And can you please specify when it first started? How many days back? Can you
Maybe
specify?
1 month or 1.5 months. I cannot
Okay,
exactly.
okay, okay, okay. That's all right. That's all right. Okay. Can you remember that? Did it come along suddenly or slowly, gradually?
Gradually, doctor. First, I didn't pay attention to it.
Okay. Can you please tell me exactly where do you feel the pain? Can you show me
Uh,
or can you tell me
it is, I think, on my neck.
on your neck? Okay. And is it present all the time whenever you take food?
Yes,
Okay. Do you feel that there is any specific type of food that makes it worse, like solid food or liquid food,
more on the solid food, but also on liquid food.
and also on liquid? Okay, that's all right. And for how long does it persist? Just for just at the time of taking food, or just does it persist even after
No,
this
doesn't
pain?
persist after taking food.
Okay, and you see you told that it has been present for last 1 month, and has this frequency increased? Like, is it present all the time now, but not before, like that, or has it been all the same from the beginning?
I think the severity has increased.
The severity has increased.
Yes.
Okay, that's all right. Yeah. Yeah. And and do you think that apart from this pain while swallowing, do you have any other difficulty while swallowing?
No, I think
Hello.
pain is the main reason.
Okay. Okay. And have you ever felt that there is any food regurgitation from your in your from your mouth?
No,
Okay. Any vomiting?
no,
Okay. Any nausea?
no,
Okay. Any tummy pain?
no.
Any chest pain or discomfort?
No.
Okay. And okay. And whatever, may I ask that whatever your bowel movement, is it all right?
Yes, doctor. I haven't noticed any problem with that.
Okay, that's all right. And may I know that do you have any headache?
No.
Okay. Any changes in your vision or any problem in the vision?
No.
Okay. Any soreness in your mouth or any cavity? Have you noticed any?
I had some soreness in my mouth few months ago, but that went away on its own.
Okay. A few months back. Okay, okay, that's all right. That went. Was it painful? Can you remember?
Yes, it was painful.
Okay. Did it bleed?
No.
Okay. Did you go to? Well, you told that it went away on its own, but did you consult any GP for
No.
this? Okay, okay, that's all right. Do you have any rash anywhere in the body?
No.
Okay, and any joint pain?
No.
Okay, any weakness in any parts of your body?
No.
Okay, any abnormal sensation in any parts of your body?
No.
Okay, do you have any cough? Can you please tell me?
No. No. No cough.
Any chest tightness?
No.
Any noisy chest?
No.
Any racing and pacing of your heart?
No.
Any shortness of breath?
No.
Okay, and any leg swelling?
No.
Okay, and what about the water work? Can you please tell me?
It's normal, doctor. I haven't noticed any change.
Okay, okay, that's very. And may I ask you now that you told that you had some history of asthma. Well, may I know that when was it diagnosed first?
It was diagnosed when I was a child, and I usually need less frequently taking those inhalers. When I feel shortness of breath, I usually take them. But I am
Okay, has there been okay, 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 yeah. Well, has there been any recent changes in your dose of inhaler?
no, no.
Okay, and you told that you rinse your mouth after taking inhaler. Well, has he always followed it? Have you always
Yes,
followed
doctor.
this?
Yes, yes.
Okay, okay, that's very appreciable. Okay. May I know that apart from your asthma, do you have any known illness like diabetes or high blood pressure, anything like that?
No,
Okay. And may I know that do you have any significant history, family history of diseases? Do you know of any?
no.
Any
I
heart issue,
cannot
any
remember
lung
any.
issue?
No, I don't know any.
Okay, that's all. That's all right. That's all right. Any family history of sudden death?
No,
Okay. May I ask you now that apart from taking inhaler, do you take any other medication?
no,
Okay. Are you allergic to any medication?
no,
Okay. Any over-the-counter medication?
no,
Any herbal medication?
no.
Okay. I'm sorry to ask, but these are some personal questions. Do you smoke alcohol? Do you smoke?
Occasionally, doctor. But actually, I
Uh,
take some cannabis.
okay, cannabis. Okay. May I know that for how long have you been taking this?
Maybe for last 12 years.
Okay, and how frequently do you take this? Can you please tell me?
Maybe 2 or 3 times a week.
2 or 3 times a week. Okay, okay, okay. That's all right. And may I know that do you take any? I'm sorry to ask, but do you take any kind of recreational medication?
Actually, doctor, I take some injection with my partner.
Okay, okay. And for how long have you been doing this?
So also for last 14 years, 12 or 14 years.
Okay, okay, okay. Any sharing of needles? You think?
I share with my partner only.
Okay, 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 okay. That's all right. I'm sorry. I just repeated. And you told that you took cannabis. Well, can you please tell me by which route do you take it?
I usually take as a smoke
Okay, okay. That's all right. That's all right. And may I know that do you drink alcohol?
very occasionally, doctor.
Very question. Any binge drinking?
No.
Okay. I'm again going to okay. And may I know that did you have any? Did you go to travel to any country recently in the last few months?
No.
Okay, that's all right. I'm again going to ask you some personal questions. May I know that whom do you live with?
I'm living with my partner.
Okay. May I know that whether your partner is a male or female?
Male doctor.
Okay, that's all right. May I know that for how long have you been living with him?
With my current partner for last 3 years.
Okay. And may I know that uh, do you use protection while being intimate? I mean, it's a very personal question, but actually, it's needed to know.
No, doctor.
Okay, okay. That's all right. And may I know that have you been to any other casual relationships other than your partner?
Uh, I had uh, 4 partners total in my life. I
Okay.
know about the previous partners. I am living with this my current partner for last 3 years.
Okay,
I
that's all
don't
right.
have any other relation with anyone except those 4.
Yeah, yeah, I get, I get. That's all right. And may I know that do you have any? I'm just going to ask you. May I know that do you have any raised temperature in your body recently?
No,
Okay. Any lumps and bumps anywhere in your body?
no,
Okay. And apart from this sharing of needles, do you have you gone or ever undergone any blood transfusion? Do
no.
you know of any? Okay. May I know what your job is?
No office clerk.
Okay. And may I know that are your symptoms affecting your job?
No,
Okay, that's all right. And do you need any help socially,
no, doctor. I am fine. 2 minutes remaining.
economically? Okay. Do you need any help socially or economically?
No, doctor. I think I'm quite okay.
That's all. Yeah, yeah. May I know what your concern is, Mr. Harry?
Why I am having this, doctor? As my GP gave me some medication, but that is not helping me.
Yes, I can get it. Well, at this moment, actually, we have to first examine you thoroughly. Then we can give you a better explanation for what is happening. But I'm sorry to say that after taking your history, okay, and after taking your history and regarding that your exposure to some needles and some recreational medication, that I fear that these symptoms might be caused by some sinister cause. Okay, I'm not sure at this moment. Some sinister cause. I think that this can be due to some infections. Okay, and we cannot be just sure at this moment. But your exposure history and also uh, medication, recreational medication history points that there might be a chance of having severe infections, and so even like HIV. So we don't bother about it just at this moment. Yeah, it's just a possibility, but we will have to run some tests, okay, and also some blood tests and also some counts, okay, some cell counts, and we will also involve the infectious disease doctor, our consultant, okay, and they will jointly decide on which test to run, and after getting the test we can uh, we can actually help you mapping out a plan. And at the same time we would like to advise you that actually just taking this type of recreational medication like cannabis is very harmful for health, okay, just apart from your present symptom as well. So it's better that you cut it down, okay, and you stop it. And also this sharing of needle is also very risky and dangerous. It can also bring about a lot of diseases. So it's very important that you also stop this and also take some protection while being intimate with the partner. Are you getting me?
So, do you think it? Time up. So do you think it is
Okay.
related to my this type of behavior?
No, it's not that that we cannot be sure for that. But what I think that some protection is better to be followed. Okay, it makes you much more safe, and that's why we are telling you. I know that it's a very personal matter, but regarding your health issues, I think this should be important for you. Are you getting me?
Okay, doctor.
Any more concerns?
are you going to give me any medication now? Because I am suffering a lot.
Yeah. Well, actually, the doubts that we have, it's more important now actually to find out the cause. Okay, because once we find out the cause, if what we suspect is comes out true, then we have to map out a different plan. So as long as I think we will first examine it properly, and then we will at first try to find out the main cause. And our next step will be to manage you properly by giving medication or other measures. Are you getting me?
So you're not going to give me any medication now.
Yeah. I will. I will. I might take you. I will consult with our consultant so that he can give you some medication right at this moment to improve your symptoms. Okay, but this might not be the specific treatment. We will at the same time run the tests and uh, try to find out the cause as soon as possible so that we can go for definitive management. Are you getting me?
Okay. Thank
Any
you.
more concerns?
No, thank you.
Thanks. Thank you.
So what do you think the cause of dysphagia for this patient?
Well, I think this patient has some complaints of odynophagia. I think uh, since he has been pained while swallowing, and regarding his, although he has some asthma issues, but he is well aware of the rinsing procedure and all these things. But regarding his recreational medication intake like cannabis, sharing of needles, and also being his sexual exposure and not taking any proper uh,
Okay.
proper contraceptive measures. Sorry,
Just
proper.
please just
Uh,
tell me what.
okay. I think that it's maybe esophagitis due to HIV. That would be my first differential. I think. Okay.
You have any esophageal candidiasis?
Yeah. I think esophageal candidiasis might be my first DD here.
Okay. So how will you investigate him?
Okay. At the beginning, uh, I will actually run some blood tests like either CBC, ESR, CRP. In CBC, we might find some problem with the lymph node, okay, like lymphocytosis or lymphopenia. And we will also go for his cell count, like CD4 counting, CD4 and CD8 counting, uh, CD8 counting. And also, we might we will go for some chest X-ray, peer view, and specific tests for HIV, like P24 test, P24 ELISA test, and uh, P24 ELISA test, and I have just forgotten the other names now at this moment. Some other blood tests and also involving infectious disease doctor.
You
Okay.
think you can do the HIV testing without patient's notification?
No. At first, I have to counsel, do some counseling. If he agrees, then we can proceed with it. Otherwise, we cannot.
Okay, you should have mentioned it during conversation with the patient that you may need to do this test.
Okay. Yeah, I get it.
Okay, so how will you manage a case of esophagitis or esophageal candidiasis? Background history of HIV.
Well, I think I will go for what the drug that. At first, we will have to find out the CD4 and CD8 count. Then I think we will have to, if it is confirmed that he has some HIV, then we will have to go for hard therapy. Okay, at first, highly active antiretroviral therapy, and apart from this, we will have to look out for the opportunistic infection. That what has caused this esophagitis. It can also be herpes esophagitis. Okay, it can be due to candidiasis. This esophagitis. So we will have to find out the exact cause, and then we can give him or her the antifungals. Okay, usually fluconazole can be given for candidiasis, and also I think at times some IV medication can also be thought of. I'm not sure, but I think amphotericin B can also be thought of in this type of cases, but I'm not sure at this moment. Okay.
Well, fine.
Okay.
So history taking was fine. You have tried to
Okay.
exclude dysphagia and odynophagia, and also sites of difficulty, sites
Okay.
of pain, and everything was fine. Just a few things that he has also been prescribed fluconazole. You could have asked that for how long did he
Mm-hmm.
take those?
Mm-hmm.
He may take 1 or 2 tablets or just a few days, so he may not improve
Mm-hmm.
that. And after that, he has also another issue that he has lost significant weight.
Yeah. Yeah. I
He,
didn't go
he
through it yet.
went for that.
Yeah. Yeah. Yeah.
And
I
also,
just forward to. Yeah. Yeah. Okay.
and
Mm-hmm.
also for this type of patient, as you are suspecting, ACP, you could have asked that, have you ever went to visit the uh, sexual health clinic? Have you ever done any test?
Okay.
He may reveal
Mm-hmm.
he has diabetes, he has HIV, or may reveal that he
Okay.
went.
Okay. 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 Yeah. Yeah.
Okay, and
I
also
get it.
in the history taking, you first asked about the family history, then you went for the drug history.
Okay. That was wrong. No. Yeah. Yeah.
Okay, that is
Okay.
fine, everything, and also you would have asked about the health of his partner. Is he fine?
Okay.
Does he
Yeah.
have any problem?
Okay. Mm-hmm. Mm-hmm. Yeah.
Okay, this is all. Do you want to add
Mm.
anything?
No, I don't think. And what was the main diagnosis? Was I right?
Yes, esophagitis that may be due to esophageal candidiasis or herpes simplex. The cause is not exactly,
Specified here. Yeah. 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 Oh. Okay. Okay. Okay.
but
So.
the one clue is that fluconazole has helped him a little. At least
Yeah.
fluconazole
Yeah.
helped him, so it indicates that most likely he has esophageal candidiasis, but didn't take those drugs in proper dose, or just only
Okay. Okay.
took this for a few days.
Yeah. Okay. So. Okay. So. Well, and, regarding the treatment, was I right that amphotericin can be given or not? I just forgot actually.
I cannot remember what.
I told that maybe amphotericin could be given. I just couldn't remember actually. I think that was not right.
No, no, amphotericin isn't necessary
Yeah.
at
Yeah.
this point. We'll take multidisciplinary sexual health
Yeah. Yeah. Okay.
clinic. They will also genitourinary clinic,
Yeah.
ECB
I
nurse.
just told that
They will
infectious disease doctor. So I think that was wrong. I should have told sexual health clinic. No.
genitourinary clinic. Yes, sexual health clinic. Sexual health clinic nurse. They
Mhm.
are more
Yeah. Yeah.
trained into this matter.
Okay. 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 So I think that's all for this case. Okay.
Okay.
Okay. Thank you.
They should have at least mentioned that we are suspecting this. We may need to do some type
Yeah. Yeah.
of
Yeah.
testing.
Mm-hmm. Okay. We have. I think we should have. I should have told that during the counseling session. Am I right? That.
Yes.
Uh,
I was
what?
suspecting
Okay.
we may need, or just giving him
Mhm.
an idea that we may need this stage.
Mhm. Okay. Okay.
Okay, fine, thank you.